Hello, Mr. Jones. How are you doing?
Okay.
I'm Professor Mehanna. Remember me from last time? How have you been since your biopsy?
Not too bad.
You've just had your examination under anaesthetic for the lump in your throat. When we examined you, you do have definitely a lump there, and it is in fact a tumour. And when we took the biopsy, it turned out to be a cancer, unfortunately. Were you expecting that?
Yes, I thought it might be. How bad is it?
Well, it's very treatable, and there are lots of different ways we can treat this for you. I'd like to talk to you a little bit about the treatment. Are you okay to go ahead with that?
Yes, that's fine.
Okay. Well, like I said, there are several ways of treating this, but the way that we would recommend to you is a treatment called chemoradiotherapy. That involves giving you high energy X-ray treatments to your neck and to your mouth over a period of 7 weeks. During that time, we also give you chemotherapy, which is a drug given to you through the vein, and that's given to you 3 times during that 7-week period. Sure, I understand. I mean, as I said before, it is tough treatment. A couple of months into the treatment or after the treatment, things will be difficult and there will be a lot of symptoms. But it does start improving after that, and whilst your quality of life will drop quite a bit during that those first 2 months, we know from lots of studies that it will start improving after that, and about a year from now your quality of life will be pretty much where it is at the moment. So it's important that you keep that in mind during the treatment. I know I've covered a lot today, and I've covered a lot just now. How are you feeling?
Yeah, okay. Sort of, it is a lot to take in, you're
Sure.
right.
Any other questions that you want to ask just now?
No, I don't think so.
Okay. There's one other thing that I'd like to talk to you about just now. We've got a study running called the De-ESCALaTE study, which is run here and in several other centres around the UK and in fact in Europe as well. And it's looking at the treatment of this type of throat cancer that you have. We now know that this type of throat cancer can be caused by two main ways, basically. The first is smoking and drinking, and the second is an infection, a viral infection called the human papillomavirus, or HPV. Have you heard about HPV before?
Yeah, isn't that the virus they were talking about on the news causing cervical cancer?
That's right. I mean, there are lots of types of this human papillomavirus. There are over 100. And in the main, they cause no problems whatsoever. They infect a lot of people and cause no problems. In some people, they develop warts on their skin, and a very small number of people, they develop cancers like cervical cancer or this type of throat cancer. So it isn't a common type of cancer, and it is something that we've only recently realized about this type of cancer. The study is looking at the best treatment for this type of cancer, especially looking at what is the best way of decreasing the side effects of treatment. And as I told you just earlier, the standard way in which this is treated in the UK is giving you radiotherapy and a chemotherapy agent called cisplatin. Now there's another agent, chemotherapy agent called cetuximab, which has been around for about 10 years, which is used in some parts of the UK, but is used a lot more commonly in Europe and America. It's thought to be just as good as cisplatin in the treatment of head and neck cancer, and its main advantage is it's thought to have fewer side effects than cisplatin. The main disadvantage or main side effect of using cetuximab is that it could cause sometimes a severe rash in the skin, especially in the area of treatment, and it can even cause skin ulceration in some people. The other big disadvantage of its use is it's pretty expensive, and so we don't use it often in the UK because of that. This study is, the De-ESCALaTE study, is looking at those patients who have HPV cancers and looking to compare the treatment with cisplatin and radiotherapy compared to cetuximab and radiotherapy. And so if you were to join this study, what we'd do is send off the biopsy that you had for testing to see if the tumour was caused by HPV. Do you follow me? Is that any questions at this moment in time?
Yeah, so there's two treatments, two types of drugs,
That's right.
and one of which has less side effects than the other.
One of them, the cetuximab, we think may have less side effects than the other one. We're not sure, we're not certain about that, and that's why we're running the study.
Right. Okay.
And so I mean, joining the study is entirely voluntary, it's an optional thing. But if you were to decide to join the study, then as I said, we'd send off the biopsy sample, would get tested for HPV. If indeed the tumour was caused by HPV, then we would allocate you to one of those two treatments. So you'd either get the radiotherapy with the cisplatin, the standard treatment that we use, or to the radiotherapy and cetuximab, which is this other type of drug. Now, the thing about it is that neither I nor you would have the choice of which drug you get. You'd be allocated to one group or another by the University of Warwick, okay, but you wouldn't be able to choose one type of treatment or the other, and I wouldn't be able to choose it either. That's called randomization, and it's a way of making sure that the study is as accurate as possible. How do you feel about that?
Well, if what is the benefit if I can't choose a group, so therefore I can't choose to have the new drug, the one with the less side effects, and the only way of getting that drug is to people after the study, and I may or may not get it, so I can't see the benefit to me.
Well, you'll have a 50% chance of getting the cetuximab, the drug that we're looking at, basically, or we're testing. But importantly, yes, you may not benefit from being part of the study, but this study may give us the answer to which of these two drugs is the better one to use for future patients. So while it may or may not benefit you, it will help future patients when we're coming to treat them, basically.
So, with both drugs, they're good treatments with a good chance of recovery?
Yes, I mean we know from previous studies that both of these drugs are effective against head and neck cancer and against the throat cancer that you have. And so we think that both of these drugs are good drugs. It's a matter of what we're looking at is which causes less side effects, basically.
Well, I can't see any reason why not to have a go at the study if it means there's a chance of getting the one which has less side effects.
I think you should think a bit about it, talk to your family about it, and maybe even your GP. I'll also ask June, our study nurse, to talk to you a bit more about the study and go over it again. I'll give you a patient information leaflet so that you can, so it's all written down and you can have it to refer back to when you're talking to your family and friends. And then let's meet up in a few days' time to answer any other questions that you may have and to take it forward from there.
So when did you say that the chemotherapy would start?
Well, the chemotherapy is likely to start in about 3 weeks' time. In between now and then, there are a few things that we have to do, like planning your radiotherapy and so on. Our clinical nurse specialist, Paul, will see you just now and talk to you a little bit more about that process and about the timelines and so on. So if you wouldn't mind, I'll take you just now to meet him and discuss that with him.
Thank you.
Okay. Hi, Mr. Jones.
Hello there.
How are you doing?
Yeah, not too bad, thanks. Not too bad.
You had a chance to think about the study?
Yes, I have actually, and I've got one or two questions to ask you, Professor.
Sure. Go ahead.
First of all, how do people get HPV?
Well, HPV is quite a common virus, and we think it's passed from one person to the other by contact. So, for example, the HPV that causes warts by skin-to-skin contact, it can be transferred by sexual intercourse. In the mouth, there may be other ways of transmitting it as well, maybe kissing, but we're not sure.
Right. So if I'm HPV positive, then I could have infected my wife and she might get throat cancer.
Well, I can see why you would be worried about that. The honest answer is we don't know for sure. But HPV is very common, and the number of people that develop throat cancer is very, very small. So the risk of developing throat cancer, even in infected people, is very, very small. And so the likelihood is, even if your wife is infected, it is a very small risk to her. And so, you know, I think you should be reassured from that point of view.
And I'm still a little bit uncomfortable with the fact that you don't seem to know which drug has the least side effects.
Well, I can understand that. I think the important thing is that you're getting, those two drugs are standard treatments both in the UK and abroad. So they are effective treatments. We just don't know which of the two has less side effects. And the only way we'll know, to be honest, is by doing this study. So, I can't maybe clarify any more than that, apart from, that it is a standard treatment that you'll be getting whichever drug treatment you get.
I'm still not sure about the study. I mean, what would you do?
Well, I couldn't possibly know how I would feel if I had this tumour, okay? And even then, we're two different people. What you might feel may be different to what I may feel, and what you would consider may be different to what I would consider. So, I think the decision has to come from you. It's important that you know that even if you decide to be part of the study and then you change your mind, then that's entirely okay. You can pull out at any time that you feel you would want to, and it won't affect the care that you get with us in any way.
Okay. I think I'll go ahead with the study.
Are you sure?
Yes.
Okay. So what we'll do is we'll get you to sign the consent form, and then after that we'll send away your biopsy sample to get tested for HPV. And once we know the result, if you are HPV positive, if the test comes back as being positive, then Warwick University will tell us which treatment group you've been allocated to, and we'll start the chemoradiotherapy. You don't have to worry about any delays because we will get the result before we are ready to start the treatment, so it won't delay your treatment in any way. Is that all right?
Yes, fine. Thank you.